COVID-19, believe it or not, is one of the things we've been talking about a lot on the sidelines of this meeting, especially because a lot of people didn't come. It's been messing with the stock market. I think there's a lot of things we don't know about. I think the big thing is the unknown. I think one thing to think about that's very important going forward is that we have what's called case ascertainment bias. The way they're finding out COVID-19 and the way they're finding out who's getting it is really from the people that present to an emergency room with shortness of breath and then have an x-ray that shows pulmonary infiltrates. It's the clinical definition right now with a fever, pulmonary infiltrates, shortness of breath. And so we don't have enough testing kits to test everybody. So there are probably a ton of asymptomatic patients that aren't even being tested. And the more of these asymptomatic patients we find, the more we realize that the death rate, which is now somewhere between at least estimated 1% and 3%, is probably going to be a lot less. Maybe even getting down toward what the flu is. We don't know for sure. That's the unknown right now. And I think hopefully in the next 2 to 3 months, we'll get a sense of how serious this really is. Clearly for someone with cancer who's immunocompromised. Clearly someone who's older who already has existing pulmonary problems. Clearly someone with metastatic breast cancer, I think, who again may have pulmonary problems from lung metastases or whatever. I think that those are the people that I think would be very at risk. And I think for that reason it's reasonable to have health professionals not congregate in big groups. Unfortunately, Miami Breast happened, so we did it. But on the other hand, I think that it's reasonable because no one wants to have their patients get sick in any event. But on the other hand, again, who knows? I mean, people seeing this may look at me like I'm an idiot, when they see this. But on the other hand, I really think there has been case ascertainment bias here, and people are saying that at a national level. We just don't know right now as we sit here, on the 7th of March, 2020. We just don't know. But I have a feeling the death rate is likely going to be a lot less than it is now. But we'll have to see.